Hello, 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 hello. Here we are again, Janine LaRue with the LaRuelist Café. And as I promised you a couple of days ago, do we have a program lined up for you today? Today, we are going to talk about mental health. This is the month of May, and the month of May is Mental Health Awareness Month. And today we're going to talk about mental health and how it relates to the pandemic. And we know that there are some folks who are struggling. We're all struggling in a certain way, but there are some people who are struggling trying to get it together. So today, our theme is going to be mental health. I am not okay. Our guests today are going to be some folks, some of them you know, and some of them you might know. Some of them you know, but you may have forgotten you know. There's one guy I know I knew that you may have forgotten that you knew him, but he's back. So we're going to start with our own Congresswoman from the 12th Congressional District, Bonnie Watson Coleman, who we just absolutely love. And are you a sight for sore eyes?
You know, it's good to see the people that you care so much about, but can only see on Facebook or checking you out when you're doing your live feeds. Hi, Janine. I'm so happy to be here. Thanks for inviting me. It's great to be on the LaRuelist Café. I swear you're one of the most creative people filling in the gap that I know. This is excellent. I've been catching them. You've had some wonderful people with some really good discussions, and it's good to be here with Crystal Pruitt. She's a phenomenal young woman, and of course, my friend from a very long time who just continues to do God's work every day, Kevin Ryan. So I'm looking forward to our having a conversation.
Yes.
About, what's happening and how it's affecting all of us, actually.
Thank you. Thank you so very much, Congresswoman. And the Congresswoman has already mentioned Kevin Ryan, so we're going to bring him on in the room. Kevin Ryan is former Human Services Commissioner and the former Department of Children and Family. In fact, you were the author of that, I do believe. And now you are doing, as the Congresswoman said, God's work, the CEO, president of the Covenant House International. Kevin, welcome.
Janine, thanks for having me. I call myself the beggar in chief. I am so happy to be on the LaRuelist Café. Thank you for inviting me, and with Crystal, who knows so much and cares so much about mental health care, and the Congresswoman, who is one of Covenant House's most regular and stalwart supporters, and my friend of a really long time. I think I had hair when maybe not. Thanks for having me. Janine, you are a convener and a movement builder, and you stitch people together. Why you are beloved, and this is another way you're doing that. You're bringing us into the light together to be community in a really new and creative way, and I'm happy to be a part of it.
Thank you so very much, Kevin, and just welcome. We love you here in New Jersey. And Crystal, we've already had a few people introduce Crystal. I tell you, Crystal and I had a busy day today because we serve on the women's group for sexual assault and misogyny of women who are working either in the legislature or dealing in politics. And that was a tough hearing. But Crystal, in her own right, she is the director of constituency.
I'm a chief of staff now. I'm a chief of staff.
Chief of staff, right? Chief of staff. And also an elected official herself, which I think is just amazing. Lucky Franklin Park, and has a background in forensic psychology and some other areas that I just think is a fascinating background, Crystal. Thank you and welcome coming on the show today.
It's honestly my honor. I was very excited to get the invitation to be on the LaRuelist Café. It's pretty much the hottest thing during this pandemic. So it's been such a pleasure, and obviously to share a panel with Congresswoman Bonnie Watson Coleman is always an honor. She's done tremendous work, especially for individuals of color, and mental health. So it's really, really important, the work that she does in that realm, and as well as all the work she does for the state of New Jersey. And Kevin, you are amazing. You created a State Department. So it's my honor. Like, I don't know anyone else who's really done that. But it's my honor to have this discussion and bring some light and exposure to how we all are feeling and how we can come to terms with how we're feeling. So I'm really excited.
Thank you so very much. We're going to explore our own feelings in this particular setting, but as I said, that this is Mental Health Awareness Month, and so right now I would like to share with you, only for 1 minute, a 1-minute video that lays out where we should be going with policy in the area of mental health moving forward. So if we could see that, that would be great. We may have to mute our mics as we bring that on.
On the rise among all Americans.
An estimated 47.6 million adults experienced mental illness.
The U.S. suicide rate rose by 25%, a national crisis.
The health of our minds cannot be separated from the health of our bodies. For those who need it, help is often out of reach, too expensive, too far away, out of network. Nearly every family in America has encountered a broken, overwhelmed mental health care system. So now it's up to us to join together and force a change. We are Inseparable, a new movement to empower us to take better care of each other, and to do it right now by demanding mental health policy that better cares for us all. No more illegal denials of mental health coverage. No more kids blocked from hopeful futures by traumatic pasts. No more using out-of-network to keep care out of reach. No more treating the health of our minds as separate from the health of our bodies. Because we all go through hard times. We lose jobs and loved ones. We get anxious and depressed. For some of us, it's clinical. For all of us, it matters. Health is health. Our minds and our bodies together. We are not alone. We are inseparable.
Thank you. So I want to start with the Congresswoman. Have some questions that I would like to. First of all, Bonnie, how are you doing?
I'm doing good. You know, I'm staying busy. I'm being overwhelmed sometimes by the conference calls, the briefings, the constant reminder why we're settled in. You know, that takes a toll on you sometimes. And sometimes I get anxiety at night and I really can't seem to rest because I think by nature, I'm a fixer and I can't fix this. So I'm trying to work in space that everybody else is trying to work in, and we're building as we're going. We're trying to figure it out. There are so many unknowns, but you know, I have a lot of faith in God, and I've got good family, and you know, I got a great husband, and
Absolutely.
so I'm very blessed. So I feel pretty good, generally speaking. Thanks for asking.
Yeah. So what adjustments have you personally had to make? Or you know, you're not doing grocery shopping and things like that. You're not going out doing that.
My husband never wants me to do grocery shopping because he says that I am wasteful. So I didn't have to make an adjustment. I didn't have to make an adjustment there. But I'll tell you what, I mean, I'm finding myself in one place. With the exception of the few times I had to go down to DC. I am in my home. I don't really go out unless I did the caravan for my brother's birthday and for my goddaughter's birthday. I am a well person, but I'm an older person and I've got pre-existing conditions. So I tell people I'm a billboard. You all keep talking about this stuff. Well, I've been there and had that. So I want to stay healthy because I have a lot of work I want to do. So I think the biggest adjustment is to limiting what I do and where I go.
Yeah, well, you know, one of the things when we talked about the theme for this particular show, and all of us on the show today, we're all very busy, very public people. And people tend to look at us a little differently, like they just got it going on. And as I speak to folks, when I get phone calls from people, and then it's, Janine, how are you doing? And then when I really think about how I'm doing, I find out that we're all a little frightened. We don't really know what tomorrow. Every morning I wake up and I say to myself, okay, do I have a cough? You know, I want to take my temperature. I really do get nervous. And I said, you know what? I'm not okay. I'm really not okay.
See, I think we're operating in a realm of so many unknowns. I think that, we've had a hard time letting science rise to the top to inform us and to give us whatever kind of confidence about what the next step is. So we don't know what the new normal is going to be. I know we're going to talk a little bit about this so-called opening up the economy again. What does that really mean? Are people going to feel confident enough to even go out and do the things that'll be open and accessible to them? So there is a sense of a discomfort and just not knowing what to expect next. But with that, we try to do the things that we're told to do. Like, I don't go anywhere whenever I go out, even when I go out in my backyard or to the car, I have a mask on. When I'm in DC, I've got masks and gloves on. I don't interact with people in very close proximity. Even a member of the family that comes by will stand out there in the backyard and talk to us. We're all very concerned about, we're going to do what we know we can do. Keep your hands clean, keep your hands off your face, safe distancing from people, and wearing masks. Now, we're going to do what we can do, eat right, basically, most of the time. I drink a lot of water, and I know we're going to get through this. I just don't know when.
Right. And now you have a task force that you've been looking at where you were dealing with the suicide rates of African-American youth. And what were your findings with that task force?
Well, first, let me tell you how I found out about the need to even address it. I couldn't open up my Facebook any day without seeing some teenager or even younger person having committed suicide. And it just got to a point where I said to my staff, we may not be able to fix it, but we got to do something about it. We've got to elevate it. And so Karen Bass, who is the chairman of the Congressional Black Caucus, and I had a conversation, and we created an emergency task force of limited duration. And I had about 25 people who worked in that space, from PhDs to MDs and to MSWs and other kinds of providers who worked with me, having a series of hearings, doing research. Even Taraji P. Henson came and presented, and so did Susan Taylor, came and presented on behalf of young people. And because what we were finding was that the attempt at suicide, the threat of suicide, and the actual accomplishment of suicide in young African-American youth had escalated disproportionately. And we needed to kind of get a handle on what was going on here. To what extent are there tools available? What's missing? What's causing this? And so we did the 6 months of the task force, and they put a report out, and the report is Ring the Alarm, the Crisis of Black Youth Suicide in America. And in that report, we have a series of recommendations and findings that we made, having to do with early access, tools that could be used, resources that needed to be available, the fact that there's not enough research being done by African-American researchers around these issues. We had conversations with the Institute of Mental Health director about grants and individuals who could inform about what we needed to be doing research on. And then we put together a piece of legislation, and the legislation is about creating or accomplishing mental health equity. And there's about $1.2 billion proposed in this legislation that will do things like train trainers on the mental health first aid kit, put resources into schools so teachers and other folks can look at signs and see what's happening with young people, not interpret the behavior as aggression and meanness or trouble, but look to see what's behind it. Because what was happening is that our children were being reacted to, our Black children in particular, when they were acting out. It was assumed that they were troublemakers and a problem, not that they were coming from a problem. So there's a lot in that bill, Janine, that will bring additional resources to schools, to churches, to nonprofit groups, as well as provide for other researchers to get a chance to really look at what's happening in our community. One last thing I want to say about this. I was in Israel more than once, and I was in one of the outlying communities close to the border. And I had conversations with some of the leaders in that community, and they were noticing that their children were really acting out and had anxieties, and they recognized it and associated with post-stress disorder, PTSD syndrome, and so they started treating it as such. Well, our children, in many instances, travel to school every day through communities where they see violence, where they're afraid, that create the same kind of stress in them. And we need people to recognize that what you're seeing is a manifestation of what they're going through, coming through their communities, as well as what might be happening in their families. And that these are things that we need to look at so that our kids can be okay.
And on that note, I want Kevin to enter this conversation, because Kevin, you are dealing with these children every day all around the world. And just in this country, how many homeless people, young people, are you estimating exist out there? Are you muted?
Okay, sorry. See,
That's all right.
you can't take me anywhere.
We can take you everywhere.
You brought me into the studio, you rehearsed with me, and I still don't know how to do this.
I love it.
I know. The other day I said to my kids, how do you do Instagram Live? They just rolled their eyes.
Oh, wait a minute. Before you answer that question, how many kids do you have, Kevin?
We have six Ryan kids and many Covenant House kids, Cov kids, but 6 Ryan kids. They're all spread out. They're in New Jersey, Texas, North Carolina, and Florida. So like a lot of families, you know, that's hard. That's part of what's hard now, is being away from our people. We expect that there will be somewhere in the order of 4 million young people who face homelessness in the United States this year. That comes from the University of Chicago Chapin Hall Center. About 3.5 million of those young people are between the ages of 17 and 22, and the rest, about 700,000, are younger. So it's just so many young people who are right now trying to respond to the pandemic and think for themselves, well, what does shelter in place mean if you don't have a place? And you're a kid and you're alone on the streets and you're trying to figure out, you know, how do I get safe? Where do I eat? Where am I going to be able to be protected from this pandemic? It is just such a stressful time for kids.
And where are you getting them placed? I know you had a major fundraiser with a bunch of stars a couple of nights ago. It was fantastic. I loved it.
Oh, thanks. I had nothing to do with that. They pointed me and said, they pointed me at the camera and said, say this. There's a lot of beautiful, generous people. You know, that is one thing that's really worth noting. There's been so much of this that's terrible. You know, the funerals and not being able to grieve with your loved ones, and the sickness and the uncertainty. At the same time, it's been such a time of generosity and goodness and love, unconditional love. So many people who are driving ambulances and restocking grocery shelves and mourning the fallen and making sure that their neighbors are well. That goodness has been unleashed in a way that is very hard to miss. And I don't want to miss it because it's frankly what's keeping me going.
Mm-hmm. Mm-hmm. You know, it's fascinating, you know, when I think about people who are homeless, those who you're dealing with, and during this pandemic, those of us who have shelter, who have a place to live, our homes have become our churches,
Yeah,
our schools, our offices, and our homes. And I think about these young people you're dealing with, and I've done a lot of reading up on some of your travels. I just don't know how they're handling this. I mean, have you had any suicides?
yeah, yeah.
Your kids you have heard of? Okay.
Yeah, oh, for sure, Janine. I mean, just to give you just a couple of examples, imagine that you are a college junior and you have lost your family, you have overcome homelessness, you managed to beat all the odds, you applied to college, you got into college, and nobody around you knows that you overcame homelessness. And then you get an email saying the dorm's closed, classes are moving to Wi-Fi, please be out by Monday. And you find yourself back at Covenant House or in a homeless shelter or couch surfing, and suddenly you have just started to slide right back down the scaffolding of your life, feeling so overwhelmed. And that's been true for many young people at Covenant House. And the young people who we have lost to suicide in Canada and in the United States, and in one instance in Latin America, I'm not suggesting that it's the quarantine that caused them to end their lives. I'm simply saying it's made it so much more stressful for kids who are already dealing with a serious mental health issue. And we've found ourselves triaging. Someone said to me a couple of weeks ago, so what do you think the next 9 months looks like? And I'm like, I'm trying to figure out what tomorrow looks like. It's about masks and face shields and gloves and having enough food for young people. And then we want to be able to make sure we're taking care of the sick and the symptomatic who don't require hospitalization, but keeping everybody else safe. So we converted across all 6 countries that we're working in, and we're in 7 cities here in New Jersey. We converted, drop-in centers and conference rooms and offices into safe quarantine units where kids could be treated. So there's a girl who was in a room with 2 roommates in Newark, New Jersey. She woke up with a fever and she found herself then in a classroom that we had converted in Newark, right by City Hall at the Covenant House there on Washington Road. We had her in there until she could be tested. And we have across the country in the United States such disparity in testing, it just will blow your mind. So in Fulton County in Atlanta, we have had every young person and staff person, all of them asymptomatic, tested 3 times by local public health authorities.
Oh my goodness.
And that's true in Anchorage, Alaska. And we've had 1 round of testing for our kids in Newark, New Jersey. But in Washington, D.C., we can only get kids tested if they are symptomatic. And in fact, that's where we have a cluster of young people. We're in quarantine in DC now. We have 12 young people as of today in our Safe Haven program who tested positive. So then we had to, we closed the Safe Haven program. We had to move healthy kids to one setting and work with the city to test the kids who were COVID-19 positive and keep them being cared for. Same thing in Detroit. We can't get a test in Detroit unless kids are symptomatic. And yet we've had so many staff and kids who test positive or begin to show symptoms that we're under quarantine. So the kids can't leave the campus, but we can't get them a test unless they get sick. Okay. So we're just living in a world where we treat every young person at that campus as if they are sick, right? PPEs 6 feet apart. But we're never going to get to the other side of this, and we're going to keep experiencing so much stress and so much social tension until we get more routine, affordable, accessible, prevalent testing in the United States. It shouldn't be about, do I live in Atlanta? Do I live in Anchorage? Do I live in LA? Do I live in Newark? That doesn't make any sense. The disease doesn't care.
Well, and you've raised something, and I'd like to bring Crystal on. I want to have this conversation with her about the young people, because it's funny. My grandson, I raised some grandchildren, and the youngest I raised is now 25 years old, and he works in New York. And I was so happy when he came back home. But when this pandemic hit, he was determined he wasn't going to do the public transportation thing again, because I do believe that the public transportation, the subways and people are just crowded on buses and trains. It's hard to social distance when you're traveling that way. So he decided, I'm just going to go out and buy a car. He just bought a car. But when I think about the disparity with people's finances, everybody can't just go out and buy a car. What are we, Crystal? How do we deal with young people when we know they've got to use the public transportation? We're dealing with a situation. My own grandson, the youngest grandson I have, no graduation this year. You know, he's a senior. We've lived for this moment. No graduate. What do we say to young people about their future?
I mean, that's a hard question, because part of the anxiety level of COVID-19 is that there's so many unknowns, right? We don't know when this is going to end. We don't know when it's going to come back. So I feel like there's a lot of arguments about we need to return to normal. We need to be productive. But I feel like that's the wrong priority. We need to be building resilience, and we need to be building flexibility and being able to roll with kind of the obstacles that are coming at us. And then also recognizing that, as you pointed out about your grandson, some of us have more privileges than others that allow resiliency to be a little bit easier, or we're able to problem solve. So what we all can be doing, and it's not just for the youth, is just recognizing that we're all undergoing trauma, right? If we start from there, this is a very traumatic experience. We are getting, death counts pushed through our phones, letting us know who's positive, who has, unfortunately been deceased. People are talking about this in terms of, as many as people died in 9/11, as many people died in, World War II. Like, we are constantly getting fed kind of like this really striking information every day, and we really can't process it, because what we're so used to processing is being able to go out and socialize, right? So it sounds really probably touchy-feely, but it's understanding that we need to be kind to ourselves. And that kindness can mean many different things. It can be taking a step back, taking a breath. It could be doing a hobby. It could be taking a nap. It could be watching a movie. It could be reaching out to a loved one. So it's recognizing that everyone is struggling, especially people who have been promised you're going to go to school, you're going to go to college, and you're going to get a good job. Well, we all kind of know that was already a questionable plan from the get-go, but this pandemic has proved how flimsy that idea is. So it's starting to support the young people and provide them with the support and the safety to let them know that this is not what the plan was. But it doesn't mean that things are over. It doesn't mean that you don't have a future.
Right.
The future's just going to be a little bit different, but you will persevere and you will be supported in doing so. So I think that's an important message to be giving the youth. So yeah, you're going to miss out on your graduation, but it doesn't take away from the fact that you accomplished that.
Right. Right.
That doesn't take that away. You accomplished that. And maybe the celebration at the end is different.
One of the things that President Obama said Saturday with the big commencement, I was so excited to be sitting in that big commencement. He said that you probably have the biggest responsibility yet of any graduating class, because you're graduating at a time where we're going to deputize you to do something about this. And I think that is a heck of a message. And I want to ask the Congresswoman, because I know she's been around the block a little bit like I have. whether normal was ever right, whether normal was really normal. Maybe we had to blow the whole thing up to get to the point where we are right now.
You know, I expect some amazing things coming out of the class of 2020, from the high school graduates to the college graduates, because they're experiencing something in real time that is just going to make them stronger. And we have a responsibility to make sure that the resources are there to support them. I'm really, you know, it's both a good time and a bad time to be in Congress. It's a bad time because it's so hyper partisan, but it's a good time because you get to weigh in on important issues like the coronavirus bills that we've been passing. And the last one that we're just voted on last Friday, that's going to be a part of a negotiation with the Senate, recognizes a lot of new normalcy, recognizes that we've got to provide some education to people in a different way. They need to be able to access it so they can be prepared. It's going to be a changing in routines and a changing in the kinds of things that you were going to pursue. Maybe you're going to find that the market is going to want something entirely different. There's money in this bill for mental health services, for mental health research. There's a recognition that we should never let a family get beneath a certain floor. So there are resources in there to make sure that you have access to enhanced food, nutrition opportunities. There are provisions that come directly to you in the form of a direct assistance payment. We're thinking now about things that maybe shouldn't just be in response to the COVID-19, but are good policy, like a guaranteed paycheck, like a universal income that no matter what, you don't get below this certain point. Like the fact that you have to have alternatives to educating and working. There's going to be a teleworking that's longer than any of us can even think about. But I expect that these young people who've made it thus far need to know that they're not in this alone. And that those of us who have responsibilities to do things like pass legislation are fighting for them, because we recognize that they are of us and we are of them.
Thank you so much.
And yeah, and so I think that, you know, a silver lining here is that we may come out of this a better people, more caring, more sharing, more recognition that we're all in this together, because this virus is no respecter of race, creed, color, national origin, sex, age, money, or whatever, you know? So we need to look out for each other.
Exactly. And, you know, Kevin, one of the things that I was talking with a woman today, very high level official in the state, and she actually, she's a survivor of the virus. So I said, oh my goodness, how are you faring? And she said, Janine, I'm doing a lot much better surviving the virus than I am homeschooling. She said, she said, if they don't find a way to have day camps, and she's watching the program tonight, she says, if they don't find a way to have day camps in the summer, I won't survive that. And we had a good laugh. But then I think about the young people you're dealing with. Oh my goodness, where do they go?
Yeah.
Suppose school doesn't open in September. What? I
know. I want to double down, Janine, on this homeschooling. One of the girls who's here home with us is a high school freshman, and she was stressed out about homework. It's so hard on these kids. And I said, I'll help you. And she said, oh yeah, okay. Spanish. I said, no. And she said, math. I said, no. Then she said, biology. I was like, what else do you got? She goes, I have an English project on a raisin in the sun. I was like, amen.
Raisin.
In the sun. I went 0 for 4. You know, one of the things I learned, you may know this, one of my Ryan girls was very sick, suicidal 5 years ago, very sick. We thought we were going to lose her. She was hospitalized for a long time. Of course, treatment works. So the miracle of her own journey is that she is happy, healthy, and well. And she was always eager for her recovery, and she participated in it fully. But I learned a lot during her illness, like parents do when your kids suffer and get sick. And I learned that things I was saying and doing to try to pick up her spirits had her feeling like she was invalidated. Wow. There's so much pressure on parents and coaches and teachers and grandparents to be fixers, to make everything be all right. So things I might say like, oh, shake that off and don't worry about that, she heard as the way you feel isn't valid. And I learned that what we mostly need and what she needed then is to be accompanied and to be validated. It's right up there with oxygen, unconditional love, and absolute respect. She also needed clinical mental health care. So I don't want to romanticize that piece of it, because she wouldn't be alive today without medicine and doctors who joined her, locked arms in her recovery. I think this is true for many, many kids, but as the Congresswoman was saying, there's such mental health disparity that one of the challenges that's right in front of us right now is how do we make sure that folks who are struggling have access to the same high quality mental health care that helped save my daughter's life. And for young people at Covenant House, I see the disparities all the time. You go into states where there is the Medicaid option as part of the Affordable Health Care Act. And those young people have so many more services that they're able to connect to. You go into Covenant houses in states that don't have healthcare for young people who are 18, 19, 20 and experiencing homelessness. And, we're relying on the goodness of volunteers. And that's, I'm not comparing us to another country. I'm comparing Texas to Louisiana. We owe our kids more than that. It shouldn't be the lottery on whether or not you get care when you are stressed. For parents who are trying to figure this out now, homeschooling, kids who might be experiencing anxiety and depression, a lack of adequate healthcare, I think it's exhale, I think it's breathe, I think it's unconditional love, absolute respect and validation. And, hopefully the government will expand healthcare so that young people or all of us who are distressed have access to mental health care, because it is the difference for some people. And it was the difference for my Ryan child. So I'm preaching from my truth. It is the difference in life and death. There's no question about that.
That's a very, very valid point. And I want to say another thing. And Congresswoman, I'd like you to weigh in on this. I was reading the other day that the reporting of child abuse, and I know, Kevin, this is something you were just on it when we began to split the two departments. You said we need an agency for children and families. And there's a decrease in the double digits of child abuse reporting. Is that a good sign, Bonnie? I mean, should we be excited about the decrease in the reporting?
No, I just don't think people are connecting to the extent that they can. And I think I think that there probably is going to show at the end of this an increase in child abuse and an increase in domestic violence. Yes. But I think people are sheltered in and they don't think that they've got any options. Government is even portraying itself as just overwhelmed by responding to COVID-19. So I think that people are making do under circumstances that we don't want them to be living under or living with. And so I can only think that the underreporting, not that there's a less incidence of it, because I'm telling you, families are stressed. They're stressed about what's going to happen. I don't have a job, or my job is on the line right now. How am I going to feed my family? How am I going to keep the utilities on? How am I going to stay in this apartment? How am I going to stay in this house? My mother is here and she doesn't feel well. How do I separate her out from the rest of the family? There is a lot of tension in the family. that it exacerbates just sort of interacting in a lashing out way from one to another. So I'm not an expert, I'm not a researcher, and I'm not a healthcare provider, but I don't believe that there is a reduction in just unhappiness and traumatic situations everywhere, particularly in our poorer communities, our more densely populated communities. And Kevin was talking a little bit about disparities. There is tremendous disparity in access to the tools and the services that you need, to the even checking on one another. And that is something that I think that, you know, we have to continue to deal with from a legislative perspective as well. And in some respects we are. One of the issues with testing, let's talk about the testing, because it's the testing and the contact tracing and the isolating and all the other things, and the treatment. We have anchored money specifically to do these things in communities where there have been higher rates of the virus reported. So that's your Black and brown and poor communities. And so there is an effort to get to the communities. One of the frustrations I have, and I asked somebody in the governor's office today, you think we could use maybe some celebrities to talk to some of these young people who are standing out in the streets in the cities with no masks on, no social distancing? I don't know what they're thinking. Maybe we don't have the right message for them. We need to find somebody that can talk to them and to tell them this is the real deal. And you can get through this, or you can get your mom sick, you can get your grandmom sick, you can get your kid sick. You know,
I want to bring Crystal in, because that is, I can't tell you, I hyperventilate when I see the young people not wearing the mask. I don't know, because they're not being defiant. And some of them, I watch them, they're wearing the mask on top of their heads like sun visors. And I'm very creative, under the chin. Crystal, how do we get this message together with young people to let them understand young people are affected by this as well?
I mean, I think it's a little unfair to target young people specifically, because it's not just young people. Yeah, there are some young people that maybe aren't taking it seriously, but there's also people in their 30s and 40s. There's people older than me. I mean, if you look at the protesters,
amazing, right?
There are not a lot of young people, but like, so right. I think we also need to be careful about how we're kind of framing this conversation when it comes to kind of how do we connect with communities, because it's about how you connect to the community. So it's not just the young people. We're not a monolith, right? So it's, you know, if there is concern in specific communities, what partnerships do you have with community leaders or respected individuals in that community that can reach that group and explain it to them? And it's also understanding kind of, there's a lot of misinformation going on with this virus, right? A lot of politicians are saying a lot of wild and crazy things. And as I believe the Congresswoman said on the top of this show, people aren't listening to science, right? They're not listening to the scientists. And there's some populations that, you know, don't trust the government, don't trust, you know, what they're being told. They're listening to things on Facebook. There's tons of conspiracy theories. There's a lot of misinformation. And I think it's important that, you know, those of us that are in government recognize that, yes, we can put this information out, but it's also really important that we're speaking to people in a language that, you know, they can respect. So maybe in New Jersey, for the groups of people that the Congresswoman said, you know, on, you know, hanging out, not wearing their face masks, maybe Governor Murphy isn't the person, right? To her point, maybe there needs to be someone that these communities can connect with. And it's maybe they're just not, maybe they don't have the resources. Maybe they don't have the PPE. Maybe they have limited amounts. There's a lot of reasons, but there is something to be said about creating information and tailoring that information to this different community so they understand, because this isn't just a youth problem, it stretches the entire spectrum of age. Obviously, in the beginning of this, we were telling, young people they were kind of okay, don't worry about it. But as we've learned more, no one's really okay. Everyone should be worried about it. So there's a lot of different things that can be done, but it's also understanding how you communicate that information and how people get information. So not everyone is watching press releases. Not everyone is reading the things in New York Times and Washington Post. Sometimes they're getting this information secondhand. I can't tell you how much misinformation I have to correct when constituents come to our office or email our office and need assistance, despite the fact that seemingly we're being inundated with this information. I think we take for granted what information actually gets down to the general public, including youth and older people who may not have the same connections.
So we're going to conclude with, and thank you for that, Crystal, because you're absolutely right. And when you said that about the folks who are protesting, I have that image in my head now. The last time I saw these hundreds of people together, and I'm like, oh my God, they're going to be walking around me in the next 2 weeks because we're opening up the state. And I want to talk about, we're going to end with the opening the state, because I'm trying to figure out, will I ever go to dinner in a restaurant again? I don't know that I'm going to be able to do that in 2020. I think I'm done with that. I love the arts, and we're going to have a show with some of the folks on who worked at McCarter Theater and some of the other theaters. And I understand they're laying off almost all of their full-time employees. I was reading that in the paper 3 days ago. So the arts are going to be different. I mean, everything is going to be different. What do you think, Kevin, what are you looking toward for this restart of our nation?
Well, you know how when you're driving somewhere, Janine, and you know the way, you stop paying attention. You know the path. But at least when I get lost, I start noticing everything. I look at the exit signs. I look at the scenery. I'm trying to find clues to where I'm supposed to be, and we're lost.
We're lost.
And the invitation is for us to be great noticers. And we can notice the goodness that I was talking about earlier. We can notice the disparities that the Congresswoman is talking about. We can notice the opportunities that Crystal's talking about to be better communicators. But right now, we have an opportunity to notice how we can build a better world together. And of all the ways we're divided, and there are too many of those, we are united in common purpose. We want a vaccine. We want to be well. We want to be healthy. And the pandemic is teaching us one thing more than anything else, and that is we need each other. So how we begin is a more complicated story, but I hope we do it together. And I hope we do it deeply thoughtful of the ways in which we need each other, not just to survive, but to thrive.
Thank you for that. Congresswoman, you have been such, you know what, when you won election, not re-election, when you won election, and I remember that night in the hotel, and I'm looking up on the stage as your group there singing that song that you love, Every Praise, and I'm like, she's going to Washington. But I am telling you, we couldn't have a better representative for our district right now than you. And I'm just so glad that you're healthy, that you're vibrant, and that you're there for us. And I don't know how you're going to do with this restart, but I want you to please continue to take care of yourself.
Well, first of all, thank you for those kind words. It's my blessing to be a representative of the 12th Congressional District. I wanted you to know that I'm going to rely upon the scientists and what they tell us. And I'm going to continue to do the things that I'm doing, like masking and gloves and things of that nature. I'm going to recognize that opening up is not just and an invitation to just hang out and get together. And Crystal, you're absolutely right. And I didn't mean to imply that it was just young people I saw hanging out. As I go into Washington, D.C., which I have on occasion these last a couple of months, I see older people without their masks hanging around talking, just socializing. And so
Hello, we see it in the White House, madam.
Yeah, I was just trying not to go there.
I just thought I had to peek over that curtain and say,
Yeah. So whatever is going to be our new normal is going to require a lot of patience, a lot of togetherness. And one silver lining in this COVID, there have been others. Our environment, our air is cleaner.
Right. Because we're not in it.
Yeah, less pollution. The water is probably more pure,
Yeah.
I want us to learn from what good comes out of this also, and how we can inform the way we live together.
Thank you. And Crystal, your brilliant mind. I've learned a lot about you in the last few months that we've worked together with this work group, and watching you a little bit more closely. I think that sometimes we don't watch our young people as closely as we should, because we will learn something from them.
Amen.
And tell me, what is going to be your restart? I'm amazed at someone your age. You're like hunkered down and you're following all the rules.
Well, yeah, I don't want to get sick.
I don't want to get sick. I love it. I love it.
I mean, my restart, and I've had conversations with my friends about this, and we're kind of leery. Like everyone, I don't want to say everyone. There are a lot of people who are just ready to have everything open up. And for me, I don't think it's necessarily the best idea. I'm not an epidemiologist, right? So, but I don't think that's the best idea. And my concern is that this really shines a light on how many people think that other people are expendable, right? Because this push to reopen, haircuts and gyms and churches and
following truth there,
right? It's not. These aren't people who are clamoring to go back to work. Well, some of them are. I'm going to preface that, but these are people who are. I'm okay with sacrificing someone else so I can have my normal. Right. And I think that's something that we have to explore, because I think and I'll use millennials and the subsequent generations that are going to come after us, we recognize there are tremendous flaws in our country, in our society, in our culture. And this pandemic is just showing them, well, I mean, I think we had some other political stuff that also showed this, how kind of fractured our country is. But this is really showing the real inequalities and disparities. So my going back out is, I want to make sure that it's actually safe and want to know that we're going to do it the safest way possible. But my restart is, this country can be, I want the country to be as aspirationally great as it thinks it is, right? And we know all the things that are wrong. We can see it. It's in everyone's faces. Will we take this opportunity to address, mental health parity laws? Will we address income inequality? Will we, give the actual respect and living wages to the people that are making sure that we're still fed, right? Are we going to actually put all of our money where our mouth is? Not with the people who already have too much of it. So, I am hopeful that, we have the Congresswoman doing the work, and I am hopeful that her colleagues will also see that, because my reopen is we're not going back to where we were. We're going to where we could be.
Right.
We're going to learn something.
Very good.
And we're going to go where we could be.
Good.
And this sacrifice, the lives lost, won't necessarily be in vain, because we're going to make sure this never happens again. There will always be viruses, but our response can be better and our supports can be better.
You must be prepared.
And
Amen.
that's my hope.
Thank you so much. And to our viewers out there, I hope if you didn't get too much more out of tonight, and I know you got a lot, a lot of nuggets tonight. But one of the things that I wanted all of us to understand, we're all not okay. It depends on the day of the week. I woke up this morning okay. And throughout the day, I wasn't okay. I'm okay again because I've been energized here on this program. But there are resources. I also want to make sure that if there are people out there who are being abused, please, I'm asking you, still find a way to call someone. You're not alone. You're not alone. There are resources if you make a phone call. So I'm just hoping that we get through this. I'm looking forward to getting on the other side because there's going to be another side. I'm asking all of you, thank you so much for coming on this program. This has been amazing. Let's stay in touch with each other, and I'm sure you're going to come back on the LaRuelist Café. Have a good night. Thank you so
God
much.
bless.
God bless you.